The absolute neutrophil count, or ANC, is an estimate of the body's ability to fight infection. The lower the ANC, the higher the risk of infection. To calculate the ANC, the number of white blood cells are multiplied by the total number of neutrophils. The total number of neutrophils are the combination of neutrophils in their immature and mature form. The neutrophils are usually reported in percentages and entered into the formula as a decimal point. The results indicate the risk that an infection is present. A low or high white blood cell count, along with a high ANC and high percentage of immature white blood cells, are very suggestive of late-onset sepsis. The combination of low ANC with an elevated IT ratio is predictive of early-onset sepsis. However, the ANC value should not be used as a sole indicator, and other values, like the WBC count, IT ratio, and assessment findings, should be the ultimate determinant for the presence of infection. Statistically, neutropenia is defined as an ANC less than 2 standard deviations below the mean value, or below the 5th percentile for postnatal age. Neutropenia can be secondary to decreased production of neutrophils, increased neutrophil destruction, or a combination of these mechanisms. Neonatal neutropenia occurs most frequently in association with maternal hypertension, sepsis, twin-twin transfusion, alloimmunization, and hemolytic disease. During the first 72 hours of life, the white blood cell count, ANC, and IT ratio follow a roller coaster pattern when plotted on a graph. The most common issue in learning how to calculate is determining which values are the mature and immature neutrophils. The CBC with differential will usually report multiple values, but for the ANC, only the neutrophils are needed. To begin, identify the neutrophils. The mature neutrophils are the segs. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes. All of these are added together and plugged into the formula, but the percentage will be entered into the formula in the decimal form. The white blood cells are reported in cell count per microliter and entered into the formula. In example 1, the white blood cells are 15,000. The mature neutrophils or segs are 19%. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes at values of 22, 1, 3, and 3% for a total of 29%. When added to the mature neutrophils, this equals a total neutrophils of 48%, or 0.48. When entered into the formula, 15,000 multiplied by 0.48 equals 7,200. This is greater than 2,000 and reassuring for no infection. In example 2, the white blood cells are 19,000. The mature neutrophils or segs are 49%. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes at values of 3, 1, 3, and 1% for a total of 8%. When added to the mature neutrophils, this equals a total neutrophils of 57%, or 0.57. When entered into the formula, 19,000 multiplied by 0.57 equals 10,830. This is greater than 2,000 and reassuring for no infection. In example 3, the white blood cells are 22,000. The mature neutrophils or segs are 19%. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes at values of 22, 1, 3, and 1% for a total of 27%. When added to the mature neutrophils, this equals a total neutrophils of 46%, or 0.46. When entered into the formula, 22,000 multiplied by 0.46 equals 1,012. This is between 1,000 and 2,000, meaning there is not a significant risk for infection. In example 4, the white blood cells are 5,000. The mature neutrophils or segs are 20%. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes at values of 40, 4, 5, and 4% for a total of 53%. When added to the mature neutrophils, this equals a total neutrophils of 73%, or 0.73. When entered into the formula, 5,000 multiplied by 0.73 equals 3,650. This is greater than 2,000 and reassuring for no infection. In example 5, the white blood cells are 5,000. The mature neutrophils or segs are 37%. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes at values of 21, 8, 7, and 9% for a total of 27%. When added to the mature neutrophils, this equals a total neutrophils of 82%, or 0.82. When entered into the formula, 5,000 multiplied by 0.80 equals 4,100. This is greater than 2,000 and reassuring for no infection. In example 6, the white blood cells are 1,500. The mature neutrophils or segs are 10%. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes at values of 15, 8, 7, and 9% for a total of 39%. When added to the mature neutrophils, this equals a total neutrophils of 49%, or 0.49. When entered into the formula, 1,500 multiplied by 0.49 equals 735. This is between 500 and 1,000, indicating a moderate risk for infection. In example 7, the white blood cells are 800. The mature neutrophils or segs are 9%. The immature neutrophils are the bands, myelocytes, metamyelocytes, and promyelocytes at values of 20, 9, 8, and 9% for a total of 46%. When added to the mature neutrophils, this equals a total neutrophils of 55%, or 0.55. When entered into the formula, 800 multiplied by 0.55 equals 440. This is less than 500, indicating high risk for infection. In example 8, the white blood cells are 850. The mature neutrophils or segs are 10%. The immature neutrophils are only reported as bands at 55%. The total count of neutrophils is 65%, or 0.65. When entered into the formula, 850 multiplied by 0.65 equals 552.5. This is less between 500 and 1,000, indicating a moderate risk of infection.